The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to another great issue of Aging Horizons. On today's show, we'll be talking about Medicaid unwinding. There's about 320,000 people in Montana that are on Medicaid. And in the next 10 months, there's a reapplication process, possibly, that you might have to do. And it's happening pretty much randomly. So we've got a lot of great information about that. Stay tuned. We'll be right back.
Can you say ombudsman?
Ombudsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Hello folks, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services, Senior and Long-Term Care Division. I'm your host, Brian Lamore, and we're talking about Medicaid unwinding. You've probably heard a lot about it in the news, in the newspapers, but they only give you a little bit of time to understand what it is. There's over 320,000 people in Montana that is on Medicaid, and of course they have family members, so this might affect probably 2/3 of our population. And there's changes coming. We're calling it the Medicare unwinding. So of course we have a wonderful guest with us today to explain it all. We have Olivia Riuta. Welcome to the show. It's great to have you here. And you're the director of the population health at the Montana Primary Care Association. And you cover Montana Project, which is connecting Montanans to health insurance marketplace, mostly for Medicaid, but you also help people apply for coverage and financial assistance for insurance. Quite the title.
Yeah,
it's really good. So, we were mentioning what is a Medicaid unwinding? How does that affect most of our population?
Yeah, I think that's a great question, and one we've been talking about a lot. So when we say Medicaid unwinding, it's really this process that we're going to go through in Montana, and every state is going through this process. So since COVID-19 began, essentially states haven't been processing renewals for folks. So whether somebody was enrolled in Medicaid or Healthy Montana Kids when COVID began, or they became enrolled since COVID, all of those folks are still enrolled and still covered by the program. And so as we move out of COVID, Medicaid unwinding is the process that our state's going to take to really go through and figure out who still qualifies for Medicaid, and then for the folks who don't qualify, really the process that they're going to take to transition hopefully to other coverage options. So it's 320,000 Montanans. It's about a third of us. And every state's going to do it differently. Here in Montana, it's going to take about 10 months, right? So we're going to take those 320,000 folks, and they're going to be broken up into 10 different groups to go through this process. It's April, and this is the first month that we're starting this process. So, so in the beginning of April, folks who are in the first group, who need to complete their renewal packet, they should have received those packets in the mail, and hopefully should be getting them back to the Office of Public Assistance as quickly as possible. So we are really encouraging folks. So it's 10 months. Not everybody is going to be renewed in this first month, but to get prepared for the process.
You know, when you say 320,000 people over 10 months, that's 32,000 a month. That's more than 1,000 persons a day. This is a major project, isn't it?
Yeah, it is a major project. I think that the Office of Public Assistance in the state has been preparing for this. We have been preparing for this to make sure that really the goal is for the folks who are eligible for Medicaid, that they understand the process, understand what kind of information they need to send in, that they're able to complete their renewal and stay covered. And then for the folks who are no longer eligible, to make sure they understand what coverage options they have, and that they have the kind of information and support to transition to another kind of health insurance coverage.
Well, it sounds like during COVID that individuals were qualified for Medicaid, and they didn't really they didn't really follow up a lot on making sure they were still eligible, which is part of this unwinding. How do people become uneligible for Medicaid, that what we're looking at for now?
I think for most folks, it's going to be income. It's based on their income. There's some folks who are kind of inherently not eligible because the kind of Medicaid they were enrolled in, for example, if they were pregnant when COVID started, right, they're likely no longer pregnant and no longer eligible for pregnancy-related Medicaid. But I think for most folks, it's going to be a question of how many folks are in their household, and then what their household income is, and whether or not they're over income for what qualifies for Medicaid.
Okay, so in order to be reevaluated, you have an information packet, but we also have a website, and individuals can go in on that website, and once they go there, they can basically put the same information in, right?
Yes, so everybody who is going to go through the unwinding process, right? So there's 10 months, there's 10 different groups, will receive a renewal packet in the mail from the Office of Public Assistance. It'll come from the Office of Public Assistance from a P.O. box in Helena, and they can either complete that renewal packet, they can send it back in the mail. Everybody's renewal will outline what information they need to provide to the Office of Public Assistance. And so they can either complete that renewal packet in the paper form, but there's also an online option. It's at apply.mt.gov, and we can talk more about why that is such an important tool, and if folks have questions, how they can get support doing that.
And you have a group of people, that an 800 number, that if they have questions, they can give it a call. But you have 10 months. I mean, if you get this, your letter in April, do you want to wait till the last month?
No. So when everybody's renewal month is kind of already determined. And so the value, what folks can find on that website is they can see what month that they're up for renewal so that they can plan accordingly. So they don't have to wait and see. They can know when their renewal month is, and then they can prepare.
Oh, that's great. Well, for our viewers, we quickly running out of time on our first segment here, but we have another segment to go. And we'll come back and we'll be talking with Olivia about more of these details and how they can help you, how you can help yourself, and how you can get better information to make these important decisions. And if you're no longer Medicaid eligible, what alternatives are there? There are some out there to help you out, so stay tuned.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. at least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about Medicaid unwinding. You've been hearing a lot about it. It affects over 320,000 Montanans and the families they're with. So this is a big issue that's coming up. You have about 10 months to do your renewal, to be reevaluated after coming off of COVID. Apparently a lot of things possibly have changed, and that's what they're checking out. Of course, we have some wonderful guests with us. Continuing, we have Olivia Riuta. You're the Director of Population Health with the Montana Primary Care Association, and no stranger to Aging Horizons, Janet Stellman, you're the SHIP Director.
Thank you.
Now, Olivia, let's start with you. There's a website that is, the individuals who receive something in the mail, they might get a renewal packet, but they could also go online, which might be easier for them and the state. Tell us more about that.
Yeah, for some folks, so apply.mt.gov is the kind of state's application portal. So some folks might have applied for Medicaid there originally, or Healthy Montana Kids, but it has a couple of things that are really helpful in this kind of renewal process. So the first thing is if you can create an account and kind of get through that process, and there's some support. If you can't, I can talk about that in a second, is to make sure folks can check when their renewal date is. So, right, this is a 10-month process. It's April, so you don't have to kind of wonder if you're going to be in July or December. You can find out when your renewal month is. So, and then you can prepare, which is really helpful. Folks can read their notices on there. So if they, if the dog eats the notice, you can go on there and see that. Folks can also sign up to get an email copy of their notices, which if you live in some of the kind of more rural and frontier parts of the state, really helps you get information faster because you're not waiting for the mail. But then finally, which I think is perhaps most important, folks can really complete their renewal. So they'll get the renewal mailed to them, but instead of kind of filling it out and mailing it back and driving to the post office and doing all that stuff, if they can just fill out the information online, upload any documents that they need directly, and then know that they're going to get it in on time.
Well, now this application renewal process is over 10 months. Individuals will have a month in which they'll get their notification, but could they go online and fill it out prior to their notification?
Sure, totally, yeah. So folks could go on today and find out, they could kind of create an apply.mt.gov account and see when their renewal is. They'll have to wait until their renewal month to complete it, but they can prepare. They can know, okay, my renewal is in September, so I'm going to start paying attention in August and look for that renewal packet. I'm going to kind of gather any information requested. Or I'm going to plan to reach out to the person that they work with in their community when they apply for programs, right?
Okay.
And set up an appointment. So people can really kind of plan ahead and make sure they know what's coming and that they have enough time if they have questions, if they need any help, to get those questions and that help in time to complete the renewal. So, so not everybody loves, creating accounts online. On our Cover Montana website, there are instructions on how to do that. And then if folks get stuck, they can reach out to our team, and we have been helping a lot of folks through that process, helping them create accounts so that they can have more information at their fingertips.
No, we're talking about a renewal, and I guess there are two things that can happen. One, you're renewed, and two, you're not. Now, if you are renewed, is that effective immediately? Is there a delay, or does it just continue? And if you're not renewed, what are your options?
Yeah, that's a great question. So I think, so if somebody gets a renewal packet, they provide the information that's requested, they will, their coverage will continue, right? And they'll get a notice from the Office of Public Assistance that tells them that.
Great.
For folks who are no longer eligible for Medicaid, I think the message is that there are coverage options. So the two we're focusing on, a lot of folks are going to be able to, if they have an offer of employer coverage, so they get coverage through either their job or their spouse's employer, they have that offer of coverage. There's an option to enroll in the middle of the year, right? Even if it's not open enrollment for that employer coverage, to get enrolled in that employer coverage. If they don't have an offer of employer coverage, and many Montanans don't, there's the health insurance marketplace at healthcare.gov. And so we help a lot of folks fill out applications, help them provide information to see if they qualify for financial benefits. Most folks enrolled in the marketplace qualify for financial benefits in Montana, and then help them have the information they need to select a plan. So, and then for other folks, they're not going to be, it's not an employer option or the health insurance marketplace, it's actually Medicare.
Medicare. And Janet, if an individual is on Medicaid and Medicare, they still have to do the renewal.
Right. So they'll be subject to the renewal over the next 10 months. Some folks didn't have Medicare before the PHE started, the public health emergency, and they maybe were on the expanded Medicaid or the marketplace, and they've aged into Medicare, and so there's going to be some changes there for them. So it's going to be especially important that they complete those packets, because the Medicaid office will look at other coverage that they may be eligible for. So,
and I know that sometimes Medicaid will pay your Medicare premiums for you under certain requirements, but we also have some helping programs, which we'll be discussing a bit more in our next segment.
Yeah, and that one you're specifically talking about is Medicare savings programs, and to pay their Medicare premiums. So
so there are some options out there, and what's important is that we do have two groups of people that can help out with the Montana applymt.gov, and others that can help you with our SHIP directors, or SHIP counselors can help you if you're over 65 and you meet some other qualifications, possibly more expanded. The point is that we're here to help you. We know this Medicare unwinding can be a little bit confusing, and we have people to help. And we have a deadline of about 10 months. You have about a month when you have your eligibility month, but we'll talk more about that in our third segment, so stay tuned.
Respite care is amazing. If you are capable of doing it, the rewards are beyond measure.
Stephanie Young, respite care provider, on the unexpected benefits of helping people in need.
Being a respite care provider is an amazing experience. It's something that what you give, you get back 100-fold. You receive so much more than you could ever imagine.
To find out how to change lives, including your own, go to respite.mt.gov.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, and my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Welcome back to Aging Horizons. We're continuing our discussion about the Medicaid unwinding, which is going to be happening over 10 months and affects over 320,000 Montanans. Well, now there's another population group out there that are seniors. They're on Medicare, and Medicaid can be paying some of those bills. And a part of this unwinding means there can be some changes to your Medicare because of Medicaid. Now, Janet, you're our SHIP director, and can you tell us about a special enrollment that could come because of the Medicaid changes to Medicare because of COVID?
Okay, so first off, there's going to be people that were on Medicaid for, people 65 and older or people with disabilities, and they're just going to have to make sure they follow the process to the renewal process. And then there's going to be those that aged into Medicare during the public health emergency or due to COVID. And so they may not have enrolled in Medicare when they became eligible. And so what's going to happen is they're going to need to enroll in Medicare. And so Medicare has given them special enrollment periods for if they didn't enroll in their Medicare Part A or B, they will have 6 months from the date their Medicaid ends to sign up for Medicare A and B. So that'll help, because usually you can only sign up, with, when you first become eligible for Part B, or when during general enrollment, which is January through March. So this is good that they've given people 6 months to sign up for Medicare after they lose their Medicaid eligibility. And they're not going to get any late enrollment penalties as well.
Really
so that'll be good, And the other one is, so if they were just on Medicaid, Medicaid was paying for their prescriptions, but Medicaid, once you've aged into Medicare, Medicaid's no longer going to pay for your prescriptions, even if you continue to be eligible for Medicaid under another program. So you'll need to look at your prescription coverage too and see if you need to pick up a Medicare prescription drug plan. There's also a special enrollment for that, which is 3 months from the date you lose your coverage to sign up for prescription drug coverage. And again, you won't have a penalty for not signing up when you were first eligible for it because of the craziness that we've had this last 3 years. So,
well, one thing that I think is important, that we got two different programs here, but now we're talking about Medicare people, and we're talking about SHIP people helping you out, because there's some questions that are going to come up. We have an 800 number and a website for SHIP people, which is Medicare people who is 65 and older,
or people with disabilities that are on Medicare.
Disabilities. And what kind of questions, what kind of usage do you think is going to come up because of this shift? Because people probably are a little uncertain about what's happening.
Well, they can sure call their SHIP counselors. We have SHIP counselors all around the state. They may not live in your community, but they cover your community. So they can help you with these renewal packets. They can also help you getting signed up for Medicare Part A and B, or also really big one is your Part D. They can really help with that too. They can help with all kinds of issues, not just related to this, Medicare billing issues or appeals or, coverage questions. So they are a great resource to your community, and just give them a call and they can help out. So, and they're trained and know what's coming and they know how to help. So.
Now, if we have that website, applymt.gov, which is Olivia's program, but if you're on Medicare, can you access that program when there's the transition here and everything?
The apply.mt.gov is actually the Medicaid. But that's where you go to update your address and stuff, but you also can create an account and know when your renewal date is going to be, and so you can plan ahead, like Olivia said, and do the renewal on there. And the ship counselor can help you with that renewal on that website. So.
But now with Medicare people, this isn't an unwinding, is it?
Well, it is, because they're still going to have to, if they were on Medicaid, just because they were on Medicaid, because they were, the senior kind or the kind for people with disabilities, they're still going to have to do the renewal. And then there's those people that lost the Medicaid that they were on because they aged into Medicare. So the Medicaid office should be looking at other programs. That would include other kinds of Medicaid, but it also could include the Medicare Savings Program. And remember that Medicare Savings Program there's 3 different levels of that, and they pay the Medicare premium, Medicare B premium, which is at $164.50 per month. And depending on the level you're at, it could pay your co-payments and your co-insurance too, depending on where you're at. So that's a big help. $164.50. That's big.
Adds up.
So that may be something they'll help you apply, move you into. But also, ship counselors can help you apply for that program if you need to apply for that program. There's also the Low Income Subsidy Program, LIS, and that helps with your prescription drug coverages. If you are eligible, it would pay your premium up to $38. And it would make you'd have co-payments from anywhere from $1 to $10 a month instead of 25% of the cost. So,
and the ship people can help you out with that.
Yep.
Well, now we're drawing to a close, and Olivia, can you give us some brief comments about your program and how important it is?
Yeah, so what I will say is I think it's great that for Montanans who are listening, who are thinking, I learned something, but I didn't figure it all out, right? I think the message that we want folks to know is that there is help available in communities across the state, or on the phone or virtual, kind of how folks want to receive information. And we refer to ship counselors all the time. Ship counselors refer to us. So if anybody has questions about what the renewal process means for them, if they get a packet and need support, they can contact Cover Montana. If we need to refer them to SHIP, we will refer them to SHIP. But that if people have questions or need help to make it through that process, don't hesitate, reach out. And you can reach out now, even if you didn't get your packet yet, if you're going to be renewed later in the year. But we need to kind of plan ahead and make sure that folks have time and support to get through the process.
I think it's great that you're both working together for our population of 320,000 people to meet the deadline for their Medicaid and maybe possibly Medicare eligibility. And for our viewers, it's been a great show. We hope to see you again next week. We'll have another great show with lots of information.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.